impact lives. And you know, when you are doing something for someone, definitely to rub off on you. If you are making people happy, why won't you be happy now? Your face cannot be like this when you are helping people. Experience is top notch.
Because when the sun shines, we shine together. Told you I'll be here for.
Hello guys, you're welcome once again to Nursing with Eunice. Today we will be talking about the healthcare assistant worker. The healthcare assistant worker. I want to give you kudos to you guys. You are doing a lot. You are doing a lot and we appreciate you. As registered nurses working alongside you, I want to say a shout out to you that we do appreciate you. There should be a healthcare assistant workers day. Is there anything like that? Please put in the comment box. Let me know. You guys are doing marvelous. What are my reasons? First, let's start with the responsibility of who a healthcare assistant is. What do they do? Then you will understand why I say they are doing quite a lot. I don't know how long this video is gonna be, but I don't care. I just want to talk about the healthcare assistant workers today. One of their responsibilities is this. The healthcare assistant are to assist the patients with their day-to-day living activities like eating, showering, using the toilet, using of equipment. We've got the hoist, we've got the stand belt, we've got the commode, we've got different health equipment. They are trained to be able to assist these patients independently. Definitely anybody you are hoisting will be a double. So 2 healthcare assistants can do that without a nurse being present. They are so competent. They can handle this equipment safely. They have been trained and they are doing it so well. I have worked with healthcare assistants such that I marvel. They are registered nurses. If you happen to be working with a healthcare assistant who has been there, working there, not just newly recruits or one that is just coming for training, respect them. They are of high value. Trust them. They know what they are doing and they work so well. They make the nurse's job so easy. I bet you don't want to see the other side of the coin. I bet you if your healthcare assistant is not happy with you and the shift goes bizarre, you want to keep saying, oh, you are the head of the shift. The nurse is the head of the shift. But what is the use of a head of a shift when the team is broken? When you can't trust your team to carry out safe care? You need to be able to trust your team. And I must tell you, the secret to doing that is your ability to trust the healthcare worker you are working with. Come to see what they do. Let's go on. We've talked about use of equipment. We've talked about taking care of the patient daily needs, taking vital signs, blood pressure and temperature. What is the nurse's job? Basically, what we do, first thing first, we want to attend to a patient, we want to know the vital signs. The healthcare assistants are trained to do this. They can check the vital signs for you and you can trust their reading. Yes. Can you beat that? Okay, let's go on. They are meeting with other healthcare professionals, assisting nurses and other staff when needed, adhering to professional standards, delivering reports to case managers and reviewing any important changes in the patient's condition. Meaning, the healthcare assistant can go to the case file and jot things there. Yes. The healthcare assistant or the nurse assistant, if I may put it, can go there and write a care plan on the patient. If they've seen a mark on the patient's body, they could write an incident report. They could go there. They could correct it. They could update the mark on the patient, the incident on the patient in the care plan, and they could give their recommendation. They could do all of that. That is interesting if you ask me. And that is a big help for the nurses. It is a big help. Now come to look at the qualities of a healthcare assistant, who they are. They are very patient. They have the ability to remain calm in stressful situations because their job is indeed very stressful. You can't imagine the number of patients assigned to them every day. And they have to feed, do the tea rounds, give medication, dress and bath this patient. If they need to transport this patient maybe to the lounge for them to have the activity time, they will do that. I'm talking about working in a care home this time, not in the hospital. or like NHS hospital. They've got a lot of things to do. And you see them with all the cheerfulness on their face, doing this professionally. They have not gone the training we've got. They've not spent the number of years we have spent as nurses. They've not done the anatomy and physiology we have done. All the big grammars we have learned in school, they've not learned that. They've just done the certificate trainings, and look at how effective they are, how helpful they are. The UK appreciates healthcare assistants, and from the bottom of my heart, I do appreciate them, because the shift will be a nightmare without them. Let's go on. They have the ability to work well with their hands. They are capable to accept criticism. You could tell them. I remember one day I was talking to a healthcare assistant. I was telling her about the urine. The patient was on catheter, and I explained to her that when we're writing about the patient being tilted, we need to put it that the urine is draining, the color of the urine, and the quantity of urine in the bag. She did not go. She was not angry about it. She said, "Oh yeah, thank you, nurse," and that was it. They accept advice. So why do people have problem with their healthcare assistants? I don't know. Sincerely, I don't know. The reason why if nurses can go on well with doctors, why can't nurses go on well with health assistants? I think we have to just drop this ego and work as a team. The healthcare assistants, to me, they are very highly valuable. They are excellent customer service skills. Have you seen a resident who come back to acknowledge a healthcare assistant, to buy gifts, to bring gifts and personalize the gift, that this gift is for so and so? Why? Because of the way they spoke to the relative, because of the way they attend to the relative. Even though they are seriously stressed with work, they are able to comport themselves. Nurses, we are the core. We are the head of the shift, so to speak. We are the home managers. The hospital belongs to the nurses. But where are the healthcare assistants? They are right there. Let's embrace them as a team. Let's work together with them. The few things they need to know, they need to clarify, let's teach them in love. And don't mistake the fact that these healthcare assistants know a lot as well. I remember those days when I was in Lutz. Lutz, the full meaning of Lutz is Lagos University Teaching Hospital. So I was working as an intern then after my general nursing. So I noticed then the matrons, they've worked for many years. Some of them 30, 35 years in service. And our mommies, you see the house officers, they'll come. Mommy, how do we go about this thing? The matron will look at them like this. You guys are using Ghana must go to carry money home. We are using envelope. You're coming to ask me questions. Go and ask your professor. The judges will not go. They're like, mommy, teach us. You are wild gas. You are wild gas. Look at the humility in those doctors. And then you see the matron explaining to them. This is in a teaching hospital, explaining to them. Even when I worked in a private hospital, I remember one doctor, then I've forgotten his name. He went to the matron and said, please come and teach me how to circumcise a baby. Then we had the patient then. He is the doctor. The patient didn't even know what we are doing. It was the matron that was teaching the doctor how to do the circumcision. Look at that humility. But the point I'm bringing out from here is this. When you do something repeatedly, you become a master of it. Yes, the doctor has been taught, but the humility of that doctor helped him to humble himself, to ask from the nurses who have been doing this for ages. And guess what? He will become expertise when it comes to doing the circumcision with his hands and with his forceps. So this shows that in health, it is not just about hierarchy. It's all about mutual understanding, cooperation, self-respect, mutual respect. That is what takes us on. And as nurses, we have to recognize the healthcare assistants as knowing a lot as well. Some of them may not know they may not know the scientific rationale for what they do. We know the scientific rationale for what they do. Yes, we can explain to them, but when the policy says do this, I'm telling you they know, and they will do it. And they love what they do. That's what I've discovered. Majority of them working in the care homes, they are there because they want to be there. And I tell you, a British person, we cannot force a British person to work when they don't want to work. They are so self-reliant. They do what they like to do. You can't force them. Even their child. If you give their child ice cream and the child says, I don't want ice cream, you don't need to ask, take ice cream, take ice cream. No, they don't want. They've told you, you take the ice cream back. They don't want. They know, they are self-aware, and which is one thing I like about them. They love what they do. I had the same experience where one of my patients, my resident, fell and the emergency bell went. So the rule says that when the emergency bell goes, the nurse, wherever you are, have to report to that place where the emergency bell is ringing from. So I went there, and the patient has to be left on the floor until the nurse comes to assess what has happened. I went there. In my mind, I was like, hey, what is happening now? Hope it's not something too big. When I get there, the patient was on the floor. When I saw the health assistant, they were all standing, waiting for me to come. And then I just looked at them, and then I said, because the angle to which the patient fell, where the patient was saying, is very close to the bed, very difficult to move the patient, you know? I did my neurological check. I ensured that there is no risk for further injury. It was safe to move this patient. Then I turned to them. I said, I am happy for us to move this patient, but what do you suggest? Which is the best equipment to move this patient? I said, I know it's the hoist, but do you think a sling can go in? One of them replied, nurse, I think we should use the sling first to move the patient out of the corner, and then we can now apply the, what's that thing called? We should use the slide sheet first to move the patient to the central point, and then we can now apply the sling to hoist the patient. Perfect suggestion. I just seconded it. Yes, let's do that. And then the team went on. You have to see how careful they are. I was just there, standing, looking at them, helping them to move the equipment. They handled the patient themselves. Put in the slide sheet, move the patient centrally, brought the sling, applied the sling, hoist the patient, and then to the bed. And I was like, wow, wow, wow. Well done. Great team. Healthcare workers. Imagine if I just got there and say, apply the sling. And then while they were trying to apply the sling, the head hits the bed. I'll be writing incident reports now. My license will be reviewed, God forbid. You get the point. So we work together. And that is why when you are with them, recognize them, appreciate them. They are a treasure. Healthcare workers are a treasure. In fact, your child might even finish secondary school and decide that he or she wants to be a healthcare worker. A lot of them are living fulfilled lives. You don't have to be a nurse. If you are a healthcare worker, I'm satisfied though. I know I have a campaign that people should become nurses. If you cannot be a nurse, you say the book is too much. If you are a healthcare worker, I'm happy. I am very happy. Just come to the healthcare field and you will smile. So come on board. Healthcare workers, we appreciate you. Thank you. Thank you. When I say they know a lot, yes, they do know a lot. You know, when you are doing something repeatedly every day, 1 year, 2 years, 10 years, some are working for over 15, 20 years. You become an expert in that thing. You can do it with your eyes closed. I started working in the UK as a home care nurse. I just behaved like I don't know anything because I was coming from Dubai and I was coming from house patients departments where it's been I can't even remember the year I gave injection last. As in withdraw injection and give. Because of my job description where I was working in Dubai. But when I was in the healthcare home, what did I do? I went to them. Even the things I know, I have to be sure. Because here in the UK, even if you know how to pass a catheter, you cannot pass a catheter without the updated training from your company. You need to do the updated training. So you need to ask questions. You need to ask questions. I kept my manager that is at home, that is already closed for the day. I will be messaging her. Yes, she said I can message her, but I have the healthcare assistant with me. I'll just go to them. Hey, mommy, what do I want to do this. What do you think? Is this okay to do it this way? This medication, this syrup has been open for the past 3 months. Is it still okay for us to use, or do I discard? What's the policy? What does the policy say? I will ask them. They will reply. And it will make them feel elated. That, yeah, I'm recognized. Let us appreciate the healthcare assistants. They are doing quite a lot. Quite a lot. And another secret I want to tell you is, if you are nice to the healthcare assistant, they see you are hardworking, you're not just telling them, go and do this, go and do this. You are involved. If the tilts are going late, the work is slow, go and meet them in a very good manner. Ask them, are we having problems? How do I help? Don't be on the pointing side that you didn't do this, you didn't do that, you should have done that. My manager taught me this. Just go to them and say, how do I help? Are you struggling? I noticed some of the things are late. They will be happy. They will tell you, oh, this is why it was late. We're busy changing the bed of Mr. A and B, and we spend more time there, but we are on it. If you can just help us answer the other call bell, that will be a great help. And they will be working with happiness. And before you know it, the shift is over. And the day is done. So as nurses, we are home managers. We want to manage our home properly. We want to be happy at work. How many jobs are you going to resign from? You leave this home today, you go to the other home. You leave the other home today, you go to the other home. Let's appreciate those we work with. Everyone, the cleaners, especially the healthcare assistants, they are working wonderful. And for those of us in my country or other countries who are planning to migrate to the UK because a golden pathway has been opened now, we can come to the UK and work as healthcare assistants for free and get the citizenship and get all the benefit that nurses get. Oh, for free. Look at that. And live in a beautiful environment. The UK is so beautiful, rich in trees, rich in green. I love nature. Oh, you will love it when you come if you are not already here. I'm going to do a video on that. Africans, other countries migrating to the UK, what it is like to work as a healthcare assistant, what are the challenges, what are the joys, we will talk about that. And to all the healthcare assistants that are currently working in the UK, I want to officially say a big thank you to you. We appreciate you. Keep doing what you do. Keep your honesty, keep your diligence, keep your perseverance. Your customer relationship is top notch. We appreciate you. We trust you. And that is why we are always happy with a smile on our face when we come to work. Yes, it is true the nurses are the head of the team. Do I say head of the shift at that time? The doctors are the head of the team, if we are to put it that way, yes. But do not look at it that way. Every boat needs a captain. We are together. We are one family. We work together in love and in happiness. All for the optimal satisfaction of our patient care. Our elderly patients, they need us. They need us to cooperate well, to work well, to give them the best care. In Britain, we don't joke with our elderly, do we? And that is why they live so long. If you want your mommy to live long, bring them to the UK. I bet you they will live long. All right, I'll end this appreciation video here, and tell me about what you like about your healthcare assistant, whom you are working with. And if you're a healthcare assistant, tell me about what you like about the nurses, or what don't you like about nurses? What do we do that you don't like? Put it in the comment chat. Let's learn. And if we need to make another review video, we are going to definitely do that. If you have not subscribed to this channel, what are you waiting for? Click on that subscribe button right now. Thank you so much for the love. I'll see you again in my next video. Bye-bye.